You guys, most of you here probably already have, you use this supplement, so you already have machines, so you've used this technology. I want to leave you guys with 3 ideas, and when we get to that particular section, I will let you know. Christopher Rex, board certified in dermatology and Mohs surgery, and a little background, went to Albert Einstein in New York for my medical school, and went to SUNY Downstate, Brooklyn, for my dermatology training. So I'm a New York guy, and love dermatology. But how did I end up here? Well, right before I left the major group to start up my own practice, some of you may know this, you have to get insurance contracts, which take about 3 months in some cases. So I started, because of this particular picture right here, I fell in love with InMode. A friend of mine who knew I was in transition said, hey, I got this training I have to go to, and do you mind accompanying me? So I fly to Arkansas, and then when it came time for her to do an in-office training, she said, hey, come on out to Idaho. This is one of her workers, one of her staff. She sent this picture to me 3 months later. Now, being a dermatologist, sometimes you get a lot of machines thrown at you, and my biggest fear was offering my patients something that did not work. I saw this picture 3 months later, remembered being at a training where I was taught that the real results are going to be at 6 months. So I said, if this is 3 months later, I called my rep immediately, and I've been hooked ever since. I want to leave you with idea number 1 today. Supersize it. If you're not already thinking along this line, think about McDonald's. McDonald's has ended the supersize cycle, but for over 10 years, they had this thing where if you ordered something, the person who is at the end of the order would say, hey, do you want to supersize it for 49 cents? Well, I did the math back there, thank God for ChatGPT and AI, but 69 million orders a day, I just want half of them to give me 50 cents extra. It turned out to be like $34 billion, it's something crazy like that. So one idea I want you to leave this conference with is you should be supersizing everything that you do in your practice. I liken my Morpheus journey to being the iPhone moment or the ChatGPT moment in my practice. I build everything around that. Now I'm moving towards quantum, but let's just stay on the RF microneedling. This was me before, right? Before Morpheus, everything was how much filler can I pump into it to make you look young, right? This is me today. I tighten the skin first, and sometimes I might not even need as much filler, and my patients are much happier. This was my first Morpheus patient. This is when I was scared of energy. I did basic settings, 15 energy, and I supersized it. I said, hey, why don't you buy this package of Morpheus? You're already here for filler, right? You might not need as much filler. How many of you know it costs more overhead for you to have filler than for someone to do a Morpheus package, right? So she ends up going 3 months with Morpheus, and then we put some mid-face filler, lip filler, and we pasted this picture. If you're not doing this, behind every door, her picture is there. Gave her a nice discount, but her picture is there, and I call her name is Kathy. I'm using her picture with permission, but please don't put it on Facebook. And I'll call Kathy the face that launched 1,000 Morpheuses, because you can't see the neck, but it's amazing what the results at basic settings did for her. Now, usually when I saw a face like this as a dermatologist, I'll be like, hey, you got volume loss. And then I'll proceed to try and talk to her about how much filler she might need, cringing that it could go into the tens of thousands. Now I'm like, hey, supersize it. Why don't you buy a package of Morpheus? I also have the Solaria. Why don't you buy a package of Solaria? No disposables. And we're going to build up a package of filler. You put it all together, and all right, my clickers paused for a second. There we go. Before and after. I usually start off by telling my patients, hey, give me a year and I could take 5 to 10 years off your face and neck. So some of you may do the mathematics of what all that revenue would be like, but you have a patient who you did not just talk about what they need right now, but you created a transformative story of what, hey, you could do with all the tools you have, right? So usually built around Morpheus, skin tightening, but I also talk to them about the skin contouring aspect of it. As you can see over here, there's some fixed treatments we did around the lower face that helps with the fat in that area. So many times we only talk about skin tightening, we don't talk about the contouring effect. So talk to your patient about the fact that you can deal with some of that jowls and fat accumulation in their neck and their face with your Morpheus. All right, and then you come back and you get those fine lines and wrinkles with Solarium. This is a skin type 4 or 5, depending on what the questions you ask her. But the biggest thing most people ask me is, hey, you're treating skin of color. What do we fear the most? PIH, right? PIH. Well, this patient was not pre-treated. If you're scared about PIH, one thing you can do is ask them to pre-treat with your best version of Triluma, compounded or order, for 2 weeks before you do it. But what I found is the depth at which you are treating them, less likely are you going to PIH them. But if you're going to be doing this, you might as well embrace PIH. Embrace it, talk to your patient beforehand, and tell them they might PIH, but you know what to do to take care of it. So you now have to weigh the option, risk and benefit. Does this patient want tighter contouring more than they care about the PIH that they would have to deal with, which very few women walk around without makeup so they can cover it while you take care of it. So you have that conversation, you build expectation, and then you treat them. I'll show you another picture of, you treat them, if they have PIH, these are the kind of go-to we all know about. Chemical peels, choose your best one. I like the VI peel. Tranexamic acid, 650 milligrams once daily. Kojic acid, hydroquinone, one version of the other, hydrocortisone, fluocinolone, or tretinoin. Put it in a compound, they treat it, they take care of their PIH. This is a patient here. She had both a face tight and Morpheus, no pre-treatment before. And if you can see from her picture over here, she also has melasma. One of our biggest fears is patient that has melasma, don't treat them with Morpheus, it could get worse. You're already treating them for their melasma. Have that conversation. Partner with your patient. What's more important to them, right? I'm not saying, hey, go out and treat everybody who has melasma, but have that conversation with your patient. You're likely already treating them for a condition that they have. Me being a dermatologist, I treat melasma all day, so I'm able to tell them, hey, look, this is what we're doing, or this is what we have been doing. Do you want this procedure? Do you see the skin laxity? Are you unhappy with the fat? We can do something. All right. So she had Morpheus, this is the settings. Now, idea number 2, prevention. If you could supersize it, you can move, I believe this is the future of IRF microneedling when it comes to Morpheus, towards prevention. We are so excited when the patient walks in with the laxity and the wrinkles, and we're like, hey, we got the Morpheus. How about talking to your patient who has a skin membership and saying, hey, you can prevent the laxity, you can prevent the wrinkles by doing some Morpheus. How about we add $100 a month to your already skin membership, and you're already paying towards your Morpheus for next year? See how I did that? Can someone say supersize it? Can someone say supersize it? There you go. You have a membership. Most of you have skin memberships. If you don't have, you should have a skin membership. Now, the person is not worried about, I don't know what your price range is. We do a package of 3 for $4,500, some at $3,000. Whatever it is, you break it down over 12 months. It probably will give them a discount. And you say, hey, you don't have to worry about how much the lump sum will be a year from now. You're already paying for it alongside your skin package. So this young lady had Morpheus 2 rounds. She also had face tight. Look at that great difference with face tight. Isn't that wonderful? All right, moving on. So idea number one, supersize it. Number two, move towards prevention. Morpheus as a preventive treatment to wrinkles. Morpheus, I feel like, is like where Botox used to be. Botox used to be only offered to people who had wrinkles. All of a sudden, we moved past that. We're like, hey, you don't even want the wrinkles. Start with your Botox right now. Embrace PIH. So this is a staff member of mine, used with permission. Please don't put it on Facebook either. We tried a different company's CO2 device that is supposed to be for skin of color patients. And she hypopigmented. Forehead, side of her eyes. She already had, the picture on your left side is right after the procedure. The picture on the right side is us treating her PIH. You can see the forehead is gone. You can see the one right around her eyebrow. She is getting better, all right? So embrace it. Start from the beginning. Get a partnership, because if it happens and you didn't tell them about it, it's your, you know what. All right? Both sides, you can see her right around her right eyebrow, PIH, forehead, much improved. Same thing. Now, this is a patient who would be skin type 4, 5. She is something I'm trying to do with the Solaria. This is not InMode talking, this is Dr. Rex talking. But the peel aspect of Solaria, which is CO2, that spreads the zones of treatment, we asked her if she was willing to try, because she has the fine wrinkles. Most times, people of color are cut away from CO2, rightfully scared. Now, I said embrace PIH. I didn't say embrace burning people, right? Okay, let's keep it in context. So we said, hey, low setting, low energy. Why don't we do Morpheus and throw on a light Solaria? And this is her after the treatment. Right? So we did the Morpheus, those are the settings. We did the light Solaria, and she had the face type. All right? GLP-1s. It's an InMode conference. I'm not going to go too into how it works. We all know that. It's all the rage now. People are injecting. They're losing lots of weight. Patients very happy, has lost the weight. If you're offering it at your practice, can somebody say supersize it? There you go. Start off from the beginning. Hey, you're here. You're going to do the GLP-1. You're going to lose weight. But guess what? You're going to have loose skin. What do I have for you? I have the Quantum. I have the Morpheus. So at the end of your treatment, when you've lost all the weight, we have something we can do for you. Bam! Look at that. Quantum with overlaid Morpheus. You think that patient is happy? These are the settings that we used. Lots of pulses, and then over with the Morpheus Burst Deep. Exosomes, a little science behind it. These are little messages within your cells that carry proteins from one to the other. Summary, science has found a way to extract them. Now they're using it in aesthetics. They're using it in joint treatment. They're using it anywhere and everywhere. But how does it amount to us? Can somebody say supersize it? There you go. You're doing treatments that cost ablation with your Solaria, with your Morpheus. You find a good wholesaler of the exosomes. You tack it on. You say, hey, good improvement, good rejuvenation. And this patient, I was not a believer in exosomes. This patient of mine, who was a derm patient, came in. She had metastatic breast cancer that went to her scalp, underwent radiation, and when she was about to start, she said, Doc, I don't want to lose my hair. I'm likely going to lose my hair. Is there anything we can do? And she said, I've heard of this exosome thing. I said, hey, you know what? I'm going to look for a way where we can get it at cost. Let me see whether this thing adds. Let's throw the kitchen sink at it. So we started injecting her throughout her radiation, right? And using other treatments. And boom, after radiation, she did lose hair. Lost a lot of hair after the radiation. We've been doing it for about a year right now. And look at that. You think I'm a believer in exosomes? Yes, I am. And I believe probably a year from now, she'll probably have a full set of hair. We don't know. To be continued. Maybe at the next conference, I'll have a picture. So seeing that, I added it to my practice. This patient who we did the light solarium on, we put exosomes on her right after. We supersized it. So in short, what are the 3 things I wanted you guys to hear from me? Supersize it. You should be supersizing everything. You should be talking about prevention with your Morpheus. Move past just old people with wrinkled skin to your young patients and say, hey, look, every year, right, you should do something for your face. Prevention, supersize. And there we go. I want to thank you guys for the time. I don't even have any more time, but these are the things that kind of have revolutionized my practice and added to the bottom line and also helped my patient have a full-rounded treatment. Hello, everybody. I am thrilled to be up here. And I felt like in my 20 minutes that they gave me earlier, I packed everything I could into that one blast and may have not been able to unpack slide by slide or unpack certain things. And I got a lot of questions at the end. So basically what I'm going to do is I'm going to go through the slides and kind of settle on some cases and talk about how me and my team kind of thought through that particular process. And then I'm going to go down the list of kind of some questions I got that what I feel is that you may have had the same question and not gotten to get to me. So I'll answer those questions. All right, let's go back. So let's go back to that particular case. I remember talking about this case, saying this was one of my first cases. A lot of times, I get the questions about settings, right? There is, I won't say a myth, but everybody kind of wonders, do you have to have these many pulses in there, these many layers in there? This was one of my first cases right after getting trained on how to use the Morpheus. I don't think we went higher than 15 energy on her, and we did only 3 passes. 2 passes of 1 millimeter on her forehead, and then the rest from her neck to her mid-face, we went 3 millimeters, 2 millimeters, and 1 millimeter, as we all trained at the beginning. I mean, since then, we have evolved into using fixed and cycles, but look how great the result was with just 15, right? So I wouldn't stress out too much about, okay, maybe I need to pack more energy into this patient or that patient. So this is just a basic, straight out training, and she got a good result. This particular lady is recent, right? With her, what we now started doing was really talking about contouring, thinking about the lower jaw area and the neck, talking about trying to get some of that fat absorbed. When you're talking about getting fat absorbed, the new Ignite machine, the Morpheus Burst has a 5 millimeter depth, so you can get really deep. And I believe, let's see what our settings look like. There you go. So we went 5, 4, 3 millimeters. This is usually lower face. We're trying to target some of that fat with the 5 millimeter, right? To try and kind of contour the jawline area and the jowls. And you can see that we kind of started switching our mode, right? We go fixed and we deliver those 4 pulses each. Now this is way different from where I started, where I just did 1 pass, 2 passes, cycle at at each depth, all right? And then for the rest of her face, we did 15 energy. I had some questions about skin of color, and with this particular patient, also earlier, about 1 year into using Morpheus, very simple. 15 energy, and basically the classic 4, 3, 2, 1. And we weren't really focused on trying to contour as much back then. We just wanted the skin tightening. One question I was asked was about, why aren't you scared about PIH? Maybe because I have patients who come in to see me almost on a regular basis who haven't had Morpheus treatments who have PIH, and we just treat, right? So if you think about it, that without you doing Morpheus, there are treatment protocols for PIH, which I will go over. That's why I say just embrace it. and talk to your patient. Some of the things I tell my patient is I show them the laxity. I show them most times they're showing me, right, the jowls, how much they hate that. And I ask them, okay, on a scale of 1 to 10, how much do you want this gone? And are you willing to really rely on makeup for, it could be up to a year. Now, when I say a year, it doesn't mean that it's going to be that dark for the entire year, but I educate them that it will get lighter, but you might have some of it all through the course of a year that you might have to use some makeup, some foundation to cover. But guess what? You'll be tight and right? So you got to kind of weigh that option. So pre-treatment, we're using 4% hydroquinone. No tretinoin, no compounding for the pre-treatment. They do that for 2 weeks. Some individuals like to do 2 weeks after the treatment. I'm usually like not wanting any kind of irritation and watching, but that is also permissible. For a patient who has melasma, tranexamic acid was proven almost 5 years ago. It was found by accident, as most things are, right? They were treating patients in Europe for menorrhagia, to which they usually use very high doses, about 500 to 600, 650 milligrams. Over here, sometimes they do 3 tablets of that for menorrhagia. So using tranexamic acid orally once daily for 24 weeks, tracking them to see how their hyperpigmentation is resolving is something that if you can't do, you can definitely recommend to a physician or a provider who can do that. But that's my go-to, right? A compound that has a kind of a triluma base and tranexamic acid. You want to educate the patient. This is what I always tell them. I say we need defense and offense. Defense is them committing to not having UV radiation in that location for at least till it's gone, right? So they have to protect their face or the location that has PIH from the sun. If not, it's like putting out a fire and then turning on the gas on the other side, right? So that is the defense. Offense, we're giving them with our skin lightening cream and the oral medication. Now, my aesthetic manager said there is actually the topical tranexamic. So we are looking for a source, and when I was talking back there, I got like 3 different places where you could get it, right? LazyMD, so you can actually throw in topical tranexamic acid. All right, I'm looking at one of the questions I was asked. I think I've hit most of them. Solaria Light. So I'm hesitant to put a stamp on the peel, but there is a different company out there who has been advertising CO2 for skin of color. So my long-term goal over the next 12 months is to figure out settings on Solaria that can be used basically by splitting, or should I say spacing out how much of the CO2 laser we're doing. What I like about it is you could do it at the same time that you have the Morpheus. So you're getting those thin layers, those fine lines and wrinkles. So this was the patient who I talked about, used that. That was about 2 months after using this combination to try and treat her PIH. Now, talking about how we are marketing this at my practice that has been very successful is picking a patient that you have that you know will have a great result, making sure you kind of give them a deal where you can actually use their face. And I said, having that before and after picture behind the door of your exam room, any patient who comes in and sits down and sees that, you want to get to a point where you're not the person who's the closer. Hopefully you're already there. You want to have the person who, when that patient asks you about what was done to this particular patient, you can delve into the science of it, you can delve into how effective it is, and you don't get trapped into the room haggling the price. So what I usually do on a busy day when I'm seeing patients, I'm doing skin checks and all those kind of things, a patient comes in, they see Kathy's pictures, Kathy's before and after. I have my spiel where I talk about when I talk about Morpheus, my go-to is, rubber is a sap from a tree, right? Yet, rubber is used to make tires. Well, what I tell my patient is we have elastic fibers and collagen in our face that over time, usually due to sun damage, gets really loose, like the sap. Well, how rubber goes from being this sap that's tapped from a tree to being a tire is a process called galvanization. Heat being applied to that rubber. Next thing you know, you're driving your SUV on it. It's nice and tight. Morpheus is carrying energy, heating up those elastic fibers and collagen, and over 3 to 6 months, they tighten over time. That's all I say. They say they love it. I say, Sarah will be right with you. And I walk to the other room. So you want to have your own package spiel if you're in a situation like me where you have a busy practice or a busy med spa where you can't do a direct consultation. If you have someone who can now unpack what you kind of concised into that little statement, you're able to have deals closing while you're treating other patients. So very important to kind of generate a closer. This particular patient, we did a combination of things. So face tight, which kind of helped us with the double chin. And then we did the sculpting where we focused on the sides of her jaw as well. Same setting as the first patient, trying to get down and get some fixed pulses. And then finally circling back for this overall skin tightening with the lower depths. That's all I have. I'd like to open the floor for questions if we had a chance, but we're going to all have the sit down. So I'll pass it on to the next speaker and then answer your questions.